Hello, and thank you for joining our podcast. I'm Sarah Jackson, and today I'm speaking with Sheree Harvey, licensed professional counselor and supervisor at InnerHealth, a premier behavioral health provider specializing in mental health and substance abuse treatment services. Welcome, Sheree.
Thank you.
Today, we're going to discuss the importance of setting and following through on goals. We'll discuss the pitfalls of not setting goals for yourself and how to challenge yet achievable goals, and offer tips you can use to monitor your progress along the way. So to get started, Sheree, what benefits can setting goals have on our mental health?
Well, first of all, it helps us kind of be motivated. It helps us look forward to something to achieve. We set goals really through our whole life, whether it's, goals to go to college, or maybe in your workplace you set goals for achieving something. So in your mental health, you want to take an active role in your what I call mental wellness. You don't have to wait until there's mental illness to be able to attack your mental health.
Absolutely. And I think, it really helps you to kind of build a solid foundation of how you're going to pursue and achieve those goals as well, which really kind of helps, in the overall process. What other benefits can goal setting have, especially for those, with substance abuse and mental health challenges that are going through recovery? How do the goals kind of help them in their process?
Well, you could look at goals as also being accountability. So when you're trying to recover from mental illness or substance overuse or abuse, you want to think about putting accountability around you. We do it all around society. We put accountability around diets that we're doing, whether it's through an app or a coach or weighing in somewhere. And you need to do the same thing with your mental wellness. Once you get through maybe a challenging time of depression or grief, you want to be able to have some steps, some action items that you can do and have in your back pocket should something, set you back. A lot of people in the mental health profession will call it your tools. What are your tools? If you went to build a house, you're not just going to take a hammer. You're going to take a lot of different tools for the different things that you need to build that house. Well, same thing. If you want to build your mental wellness or if you want to stay strong in your recovery, you're going to have that, bag or box of tools. And those could include things like a sponsor, a therapist. Many times people will see an individual therapist in a time of crisis. And then they kind of see that, oh, okay, I've seen you maybe 3 months, 4 months, the crisis is over, I'm done with therapy, which is great. That's the goal. You want to progress. But I would keep that therapist in the back pocket as a tool because you're going to go through other challenges in life, and then you can call that therapist and say, hey, can I come back in for a refresh or just support? Again, for recovery, if we're talking more of addiction recovery, besides maybe a sponsor, you want, again, professionals around you. You want a sober network of people. You want to make sure you're finding sober friends. All those kind of, and you want to have goals set to find those things because those are things to strive to achieve to help you. Again, you must take an active role in your mental wellness or your recovery. Absolutely. You can't just sit back and let it happen because it won't. It'll set you up for failure.
Wonderful. Well, Sheree, thank you so much for your insights today. I know they're very valuable. We greatly appreciate it. If you'd like to learn more about goal setting and process monitoring for substance abuse and mental health treatment, you can reach out to the experts at InnerHealth by calling 800-388-4601 or visiting innerhealth.com today.